In 1990, I was involved with a group in Boston that opened up a clinic to treat people who are HIV positive. So I knew acupuncture was helpful. I knew it could really help with symptoms of HIV and the side effects of the medications used to treat it. Then a number of years later, when in the news finally people were talking about how bad things were on the continent of Africa, I just had this very visceral response, which was, I'm going to go to Africa and treat people, with the treatment that I knew would make a difference. But I realized that one person could not do enough. I knew that the best approach would be to train local health providers, thereby greatly increasing access to acupuncture. I wrote to hundreds of people in countries across Africa who were working with HIV, and I got very positive responses from almost everyone. But it was a doctor from Uganda who wrote back and said, "Consider me your Ugandan contact person." 2 weeks later, she had put together a team to operationalize the project. At its worst, 30% of the population is said to have been HIV positive. They were willing to do anything to really help the people and save the country. So they were very eager for us to be here. And 10 years later, we are still here.
We have a lot of problems in our healthcare system. For instance, we don't have enough health workers. We don't have enough drugs. The infrastructure is poor. And with HIV/AIDS, it has been a problem. With this training of PAP, at least even if there are no drugs, when these patients come, they will not go with nothing. And I've seen acupuncture really work,
I have treated paraplegics and see them improve. And that makes me firm enough to continue with acupuncture. I have been saying acupuncture does miracles because I had an answer to some of the elements which I didn't have an answer to in orthopedic medicine. My patients come from far and wide. My prospect from PAP training is so great. It enables me to treat my patients and I feel comfortable.
Even when there are no drugs in these health facilities, the health workers don't feel they are helpless when these patients come. At least they have something to provide.
I remember we finished the training on Friday. Next morning, which was a Saturday, when I sat in my clinic receiving the patients, at least I could get some who need that technique. And I saw that that was the right time for me to apply when I'm still very fresh from the training. So it helped me really.
When I hear people talk about it, I realize that it is having an effect on the people.
These are conditions which are chronic. These people have gone to Western medicine, it has not worked. They have gone for traditional healer, it has not worked. They have gone for herbal, it has not worked. But with acupuncture, just one treatment. Like yesterday, they treated a woman. She had a backache and the legs were so painful. She started jumping, showing, with acupuncture, the results are immediate.
That's what it's all about. I mean, seeing that happen and people seeing that this very relatively simple treatment can have profound effects on people.
The protocols that are used in the manual are simple, but they are also points that I use in my practice all the time. But they're it's just honed down. It's practical here, it works. This is what they need on the ground, and they can do so much good. It's really effective. I'm seeing it really working.
To the point where the trainees arrived at the second day before we did, and they took it upon themselves to go ahead and start treating patients in the line without us there. And they did a perfectly fine job because they had a sense of navigating the manual, working together, being creative, and having a sense of confidence.
One of the goals that I stress to the other trainers is the importance of increasing their level of confidence. If they're not confident, they're going to leave here and they're not going to do it.
The way Richard has designed this manual, anybody with a solid medical background can find the acupuncture points and design treatments just on the fly.
With the use of the manual, I saw it very interesting and not challenging. It is not all that very difficult, because as a medical health worker or as somebody who did some science, we are used to needles. We know what needles are, And that's why we have picked up very fast and then enjoying the thing.
What keeps me engaged, excited about coming back is I feel connected to the people here and I get a lot of appreciation for the work. And then I just see that they continue to embrace the acupuncture, both the patients and the trainees, seeing the smiles on people's faces when they realize what they did really helped somebody. I mean, they went from knowing nothing about acupuncture to seeing that what they did, the insertion of acupuncture needles, really made a difference in people's lives. And generally, they're really eager to come back and again have that kind of supervision. So I think it's kind of mutually satisfying and mutually reinforcing.